Hello and welcome to my channel. In this video we will be looking at AQA Alevel Psychology 2017 Paper 1 Exemplar Answers for Psychopathology, which you need to know for AQA Alevel Psychology. I hope you enjoy this video and find it helpful. Let's get started. Please note that these answers have been produced with knowledge of the mark scheme but have not been approved by the mark scheme themselves. There are 3 assessment objectives, AOs, in psychology. In this video they are color-coded. AO1 Knowledge, purple. AO2 Application, blue. AO3 Evaluation, red and green. Question 1. Which 2 of the following are cognitive characteristics of obsessive-compulsive disorder, OCD? Choose 2 from the options A, B, C, D and E, 2 marks. A. Awareness that behavior is irrational. B. Compulsions. C. Disgust. D. High anxiety. E. Obsessions. A. Awareness that behavior is irrational and E. Obsessions. Question 2. Outline 1 or more ways in which behaviorists treat phobias. 6 marks. Systematic desensitization is a type of behavioral therapy based on the principle of classical conditioning. Using counter-conditioning, the process by which a new conditioned association response is created and learnt to a stimulus that already has a maladaptive conditioned response, and the idea that 2 opposite emotions cannot coexist, reciprocal inhibition. This therapy aims to gradually remove the fear response of a phobia and substitute and elicit an antagonistic relaxation response to the conditional stimulus gradually. This will lead to the extinction of the fear response. There are phases to this treatment. First, the patient will be taught relaxation, such as mediation, breathing techniques, where the patient will focus on their breathing and taking slower, deeper breaths, as anxiety often results in faster, shallow breathing, mental imaging techniques, where a patient may use here and now skills which involves focusing on a particular object or visualizing a relaxing and peace scene, and progressive muscle detensioning techniques, where a patient will strain and relax their muscle groups gently. The patient will then create a fear hierarchy with their therapist, which is a list of situations related to the phobic stimulus, from least to most fear-provoking and anxiety-inducing stimuli. For example, say hear the word sound, look at a picture, hold a picture, look through a window, walk past, hold. This will provide a structure for the therapy. The patient will work their way up the fear hierarchy, taking a step approach and being gradually exposed at each stage, starting with their least fear-provoking and anxiety-inducing stimuli. They will practice relaxation techniques until the stimuli no longer produces a fear response, when at this point, they will move on to the next stage in the hierarchy. If the client later produces a fear response, they can return to an earlier stage and regain their relaxed state. Eventually, this will lead to the extinction of the phobia when the most fear-provoking and anxiety-inducing stimuli is responded to with relaxation. The number of sessions required depends on the severity of the phobia. Usually, 4 to 6 sessions, up to 12 for a severe phobia. Exposure can be done in 2 ways: in vitro, where the client imagines exposure to the phobic stimulus, and in vivo, where the client is actually exposed to the phobic stimulus. Flooding, also known as implosion therapy, is based on the idea that anxiety cannot be maintained indefinitely and eventually subsides. Flooding aims to expose the sufferer to the phobic object or situation for an extended period of time in a safe and controlled environment. A person is bombarded with fear by being immediately exposed directly to their most fear-provoking and anxiety-inducing stimuli, which causes a state of extreme anxiety and panic. However, eventually, exhaustion of the phobic response sets in, and the anxiety level begins to go down. This prevents avoidance, and therefore, prevents the reinforcement of a phobia through escape or avoidance behaviors, which allows patients to understand that the phobic stimulus is harmless. The exposure and bombardment will continue until anxiety subsides and an extinction of fear response occurs. The patient will also taught and encouraged to use relaxation techniques prior to the exposure of the phobic stimuli, which continues until the patient is able to fully relax. Prolonged intense exposure eventually creates a new association between the feared object and something positive, e.g. a sense of calm and lack of anxiety. A flooding session can last for 2 or 3 hours. Rob is a sixth form student who has started hearing voices in his head. The voices come often, are usually threatening and make Rob feel frightened. The voices are making it difficult for Rob to complete his homework properly, and he is worried about how this may affect his chances of going to university. Rob has not told anyone about his experiences, but his parents and teachers have noticed that he appears distracted, anxious, and untidy. Question 3. Outline and evaluate failure to function adequately and deviation from ideal mental health as definitions of abnormality. Refer to the experiences of Rob in your answer, 16 marks. Failure to function adequately is defined as abnormal behavior that causes personal distress or distress to others and anguish or inability to cope and deal with the demands of everyday life and living. Rosenhan and Seligman, 1989, suggested 7 criteria that are typical of FFA, including personal distress, anxiety, depression and fear, unpredictability, displaying unexpected behaviors and loss of control, irrationality, vividness, observer discomfort, violation of moral standards and maladaptive and dangerous behavior. The more features of personal dysfunction a person has, the more they are considered abnormal. To assess how well individuals cope with everyday life, clinicians use the Global Assessment of Functioning Scale, GAF, which quantifiably rates a person's level of social, occupational, and psychological functioning on a scale of 0 to 100 and the extent to which a mental disorder affects an individual's ability to function adequately. A person who scores highly, e.g. 80+, will have few if any symptoms that prevent their ability to function, whereas a person with a very low score, less than 20, will struggle in society and may even be a danger to themselves or others. Rob is not coping with everyday tasks, as he cannot complete homework and he is untidy. Rob is causing others distress, as his parents and teachers. He is also causing personal distress to himself, as he is experiencing feelings of anxiety and he is frightened. A strength of failure to function adequately as a definition of abnormality is that it recognizes the subjective patient's perspective. This definition takes a patient-centered view by allowing mental disorders to be regarded from the perception of sufferers. An individual who may be struggling to function adequately and wishes to seek intervention can do so based on their own experiences and feelings. This approach emphasizes the importance of personal insight into one's mental health and acknowledges that individuals are the best judges of their own functioning. By focusing on how well a person is coping with daily life and their ability to fulfill personal and social roles, this definition can lead to more tailored and relevant treatment options. It also empowers individuals to take an active role in their mental health care, as they can express their struggles and needs, fostering a more collaborative relationship with mental health professionals. Furthermore, this perspective can help reduce stigma, as it validates the experiences of those who may feel marginalized or misunderstood by more rigid definitions of mental health. This is a strength because it suggests that mental health assessments should be grounded in the lived experiences of individuals, allowing for a more nuanced understanding of their struggles. By prioritizing the subjective perspective, it acknowledges that each person's definition of functioning can vary greatly, leading to more empathetic and effective treatment approaches. This focus on personal insight helps to ensure that interventions are relevant and supportive, ultimately promoting better mental health outcomes. A limitation of failure to function adequately as a definition of abnormality is that it may be a normal reaction to a traumatic event, such as bereavement or grief. In these situations, individuals may experience significant emotional distress and a temporary inability to function in their daily lives, which is a natural response to loss. This definition might label such reactions as abnormal, potentially leading to unnecessary concern or intervention when, in fact, these responses are part of the human experience. It fails to distinguish between a transient reaction to a specific event and a more chronic mental health issue. This is a limitation because it suggests that the criteria for defining abnormality may overlook the complexities of human behavior and emotional responses. By labeling certain reactions as inadequate, it fails to account for the context in which these behaviors occur, such as in response to significant life events. This can lead to misinterpretations of an individual's mental health status and may not consider that temporary dysfunction can be a normal part of coping with trauma or loss. Consequently, it risks pathologisting natural human experiences, which could hinder appropriate support and understanding. Deviation from ideal mental health is defined as behavior which fails to meet a particular prescribed criteria for psychological normality, well-being, and good mental health. Jehoda, 1958, proposed 6 criteria of optimal living for ideal mental health, with an absence of these characteristics indicating an individual to be abnormal. The criteria includes an accurate perception of reality, being realistic and objective about oneself and the external world, ability to cope with distress, being able to effectively deal with the challenges of life without excessive stress, environmental mastery, the ability to successfully navigate work, social, and other situations, self-actualization, achieving personal growth and progress, realizing one's potential, positive attitude towards oneself, being happy with who you are and having self-respect and self-esteem, autonomy, being independent, self-reliant, and able to make decisions for yourself. The more criteria someone fails to meet, the more abnormal they are. Rob's perception of reality is not accurate, as he is hearing voices and the voices are preventing Rob from fulfilling his potential and achieving self-actualization. This may affect his chances of going to university. A strength of deviation from ideal mental health as a definition of abnormality is that it is grounded in concepts similar to those used in physical health models. This approach allows for a more holistic understanding of mental well-being, as it sets clear criteria for what constitutes ideal mental health, such as the ability to cope with stress, maintain healthy relationships, and have a sense of purpose. By comparing mental health to physical health, it emphasizes the importance of striving for a state of well-being rather than merely the absence of illness. This perspective can help reduce stigma around mental health issues, as it frames mental health in a way that is relatable and understandable. Furthermore, it encourages individuals to seek help not only when they are experiencing severe issues but also when they feel they are not functioning at their best. Additionally, this model can guide mental health professionals in developing treatment plans that aim to enhance overall well-being, rather than just addressing symptoms. This is a strength because it suggests that mental health can be approached in a similar way to physical health, which can help normalize discussions around mental well-being. By establishing clear criteria for what constitutes ideal mental health, it encourages individuals to strive for improvement and seek help when necessary, fostering a proactive approach to mental health care. This perspective not only helps reduce stigma but also promotes a more comprehensive understanding of mental health as an integral part of overall health. However, mental health may not be the same as physical health. One significant distinction is that mental health is often influenced by a complex interplay of emotional, psychological, and social factors, which can vary greatly from person to person. Unlike physical health, which can often be measured through specific biomarkers or physical symptoms, mental health is more subjective and can be harder to quantify. Additionally, the stigma surrounding mental health issues can differ from that associated with physical health conditions. While physical ailments are generally accepted and understood, mental health issues may still carry societal stigma, leading individuals to feel reluctant to seek help. Furthermore, treatment approaches can vary significantly. While physical health often relies on medical interventions, mental health treatment may involve therapy, lifestyle changes, and support systems that address emotional and psychological well-being. Lastly, the concept of ideal mental health can be more fluid and less universally defined than physical health standards. What constitutes optimal mental health for one person may not hold true for another, making it essential to consider individual differences and experiences in mental health discussions. This is a limitation because it suggests that there may be a lack of understanding or acknowledgement of the complexities involved in mental health compared to physical health. It can lead to oversimplification and hinder effective discussions about mental well-being. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.